Hello everyone, welcome to our educational channel. My name is Zetu. I am a registered nurse. Today I would like us to talk about liver cirrhosis or cirrhosis of the liver. What is liver cirrhosis? Liver cirrhosis is a severe form of liver disease where the normal liver tissue is replaced by the fibrous tissue or scar tissue. As a result, the liver becomes stiff. Because of this problem, the liver is unable to perform its functions. What are the functions of the liver? Liver produces bile, and bile is a digestive juice that is responsible for our digestion, and it emulsifies fat during digestion. Liver produces certain protein for blood plasma. Liver stores fat-soluble mineral salts and vitamins, an example like copper and iron. Liver stores extra blood sugar and it releases to the body when it is needed. Liver create certain immune factors that can fight against infection. Once the liver is diseased, therefore it is not easy for the liver to perform these important functions. This diagram will show you a normal liver, and it will also show you a liver with cirrhosis. What are the causes of liver cirrhosis? A long-term alcohol intake or alcohol consumption. The second cause may be chronic infections like hepatitis B or hepatitis C. Third one will be a fatty liver that can also lead into liver cirrhosis. Exposure or a long-term exposure to poison, or another cause, it can be a long term of taking certain medication that can cause a problem in the liver. What are the signs and symptoms that we can see if the liver is affected? It does happen at times that the liver is affected but it's not showing any signs and symptoms. And in that case, it can be discovered maybe when the patient is going for another test. In that case, where the liver cirrhosis is discovered or is diagnosed and is asymptomatic, it is important for that individual to do regular follow-up with the physicians. In some cases, the liver cirrhosis shows complications. It means it's symptomatic and the patient is getting sick because of this problem. What are the signs and symptoms when the liver cirrhosis is giving complication? One is a yellow discoloration of the skin as well as the eyes, and we call it jaundice. The patient develops an itchy skin and the skin is easily bruised. The urine becomes dark and concentrated, and in severe cases, there's an accumulation of fluid in the body, and some patient will be having ascites, where there's a distended abdomen full of fluid, or the feet will also be swollen. There's loss of appetite. Because of that, the patient will end up losing weight. Once all those signs are there, that patient needs immediate attention so that they will be getting some medical help. How is liver cirrhosis diagnosed? When the patient is in the hospital, there will be history taking, especially if the patient is showing all the signs and symptoms. They will take history where they will know when this condition started. Although it's a long-term condition, it doesn't start now and show symptoms. You'll find that it has been there, but slowly and slowly is progressing. 2, they will do physical examination where they will find out what may be the other symptoms maybe that are not showing at the patient at that time. They will do blood test. On blood test, they will be doing liver function test. And the other things, they may do imaging, where they will do ultrasound, they will do MRI, and to make sure how is the condition has progressed. That is also important so that the doctor, they will actually know what can be done for that patient at that particular time. In severe cases, sometimes they may even do a liver biopsy before they could start the treatment. Once the diagnosis is confirmed and all the tests are there, then they will have to start the treatment, because if the treatment is not started and the patient is showing all the serious signs and symptoms, is dangerous and it can be fatal if the treatment is not started. One of the things that you can do, you will actually try to treat the underlying causes. One of them is alcohol. The patient has to stop drinking because that will help. If the patient is having chronic infection, Hep B or Hep C, and that one, you have to make sure that it's controlled. There will be medication that will be given, and make sure that the patient is following up with the medication to control those chronic infection. Is the change of the lifestyle, and the patient, they will actually prescribe what she can take or what she can eat, just to help to try not the condition to become worse. And another thing, they may even do some tapping or drainage of the ascites. If the patient is having difficulty in breathing, some patient will be taken to drain ascites. Some medication like diuretics can also be given, just try to help to reduce edema, especially if the patient is having severe ascites. In fact, in this condition, you have to treat the symptoms that the patient is presenting. Some studies shows that if the patient actually stop, especially alcohol as the time goes on, the liver can actually start slowly to repair its damaged liver tissues. But what is important is to make sure that the patient work hand in hand with the doctors. He must follow the appointment as prescribed. In between, as the patient is taking treatment, the doctors may actually make some follow-up. They may even do some endoscopies and see whether the patient is getting help. This is very important because you cannot just treat the condition. It's a slow progress, and follow up and make sure that all doctors' advice are followed, and the support from the family to ensure that the patient is being supported by the doctors as well as the family members. It is important to continue with the treatment because if the treatment is not started, the condition can get worse. For today, we will stop here, and you can suggest what we can discuss next time. And it is important for all of us to keep in touch and support one another to improve our health and to improve our health issues. And it's also important to work hand in hand with our physicians as well as our health providers. Thank you for watching. Till next time, stay safe and stay healthy.